Okay, let's not forget about the skin. That's the outer wrapper. That is the largest surface area organ on your body, on the pet's body, and it's often considered to be a reactive organ. So a lot of changes can be seen in the skin for a variety of different reasons that are important to watch for. Dogs that have allergies typically can chew or bite at all different areas of their skin. So I think it's important that you get used to knowing what their normal skin looks like. So first look in the areas where there's no fur, particularly under the belly and on the base of the paw, all 4 feet, between the toes, the ears. It's all one organ. Because many dogs, especially our allergic patients, which probably comprises about 35% of all of our skin issues, will just itch and bite and chew, and there won't be anything there. Moving on to a more advanced stage of allergic skin disease or any other type of skin disorder, you may start seeing some lesions on the skin, and that could mean redness, flaking, swelling, or even for that matter, scaling, crusting, or any odor. If you notice that, that could be indicated that you're moving into a range of infection, either superficial or deep infections. Since pets are prone to getting external parasites, most typically fleas and ticks, it's really important that you know how to screen for that. I recommend getting a fine, very fine metal comb on a regular basis, just combing your pet out. That helps remove some mats and dead coat, but also looking for the remnants of flea dirt. And flea dirt typically looks black, and if you put it on a little cotton ball with water, it turns orange because that's dried blood. Nowadays, because most of our pet owners are using active flea control, and it's gotten so much easier than it used to be when I first started in practice, there's really virtually no reason to ever have fleas on your pets. Every now and then I see them, and up in the Northeast, we typically see them at the end of August right through December. If you live in places like Florida, it's relentless and you don't ever get a break. It's important to know, though, because fleas are a source of infectious disease that are spread to pets as well as people. So you really want to make sure you use something on a regular basis. Ticks can be anywhere. They tend to be, a lot of time, like to make their way up around the head and neck. They're very hard to find, especially the immature ticks, I'm sorry. So I would not rely on finding them and pulling them out. You want to use some kind of regular flea and tick control. And nowadays, with the monthly preventatives, or in some cases every 3 months, we get excellent tick control without having to deal with using topical parasiticides that are messy and smell. I think you want to bathe your dog as often as you feel your pet needs it. I don't think you can dry your pet's coat out. You know, some of the fancy breeds that are combed and poofed up and are high maintenance breeds, they get bathed regularly, but certainly for the average dog, like in Addie's case, dry, you know, relatively short to medium coat. In her case, I bathe her as often as it takes to keep all the deer poop off of her because she loves to roll and stuff and stink. So I would not be afraid to bathe her as often as you need to. I do think you should get in the habit and know your pet's coat, right? Like if you have a boxer or a dachshund or short coat breed dog, there's not a lot of grooming involved there. But with her coat, typical to what you see in the lab, you do get a lot of shedding that happens about every 12 weeks in the cycle, and you get this dull kind of lighter appearing color coat that a lot of times owners are concerned about. That's just something that requires some stripping to get rid of. Some breeds that have longer feathers on the back, like Australian Shepherds and Golden Retrievers, that's a higher maintenance issue, and they typically will pick up brambles, and they will pick up also more parasites that way as well. So you want to make sure you keep that combed out and trimmed. In some cases, we use antibacterial wipes for dogs that are prone to recurrent infections, and some of the best ways to manage pets that have chronic recurrent skin infections is to use topical shampoos that are antimicrobial, because we do want to get away from chronic antibiotic usage that will tend to set us up for recurrent infections. From all of the information that we've gathered so far as of today, and we know it changes every day, pets can get passive infections from people, but they don't transmit it from themselves to us. We have found that serologically, meaning if we test their blood, many of these dogs, especially cats, have been exposed and have developed infections, but they spontaneously resolve them, and they're not a natural host for infection. Now, if you want to disinfect them passively because you're concerned about other people that come into the house, then you can use wipes such as Rescue, which is a accelerated hydrogen peroxide, or there are a variety of other topical disinfectants that you can use that are safe on their coat. Remember that the virus doesn't really last very long in the environment on inanimate objects. It's more on an aerosolized and a droplet basis where it can spend some time floating in the air. So I don't think that that pets are a real major concern for source for infection of COVID.